Hello again. This is my presentation on our week 4 assignment on the role of dietary management in chronic diseases. Before I go on and talk about the three diseases that I decided to choose, or that I chose, sorry, I did want to go over the learning outcomes for this week. So for our discussion post, we were to compare eating disorders, and for this assignment, we are to talk about 3 diseases where diet is a critical component of managing it. I decided to choose celiac disease, Crohn's disease, irritable bowel syndrome. From there, I'll talk about how the dimensions of wellness connect, and I will discuss some meal suggestions for a day for each disease. First off, Crohn's disease. It is considered a chronic inflammatory bowel disease. Crohn's causes inflammation and irritation in the gastrointestinal tract, mostly in the large and small intestines. Although individuals with Crohn's may experience remissions, this disease will worsen over time, especially if you're not taking into consideration dieting. Those with Crohn's may experience health complications such as intestinal obstruction, fistulas, abscesses, anal fissures, malnutrition, ulcers, and inflammation in other areas of the body. Although doctors aren't sure what causes Crohn's, it's said to be an autoimmune reaction. Smoking, having a high-fat diet, and taking non-steroidal anti-inflammatory drugs, or NSAIDs, may increase one's risk. So here we have some of the more common symptoms. So we have diarrhea, weight loss, and abdominal pain. Other symptoms can include anemia, eye redness, fatigue, fever, joint pain, and soreness. And in addition to this, you also want to take into consideration how your symptoms may vary depending on the location and severity of the inflammation, and how stress can play a factor as well. Moving on, I just wanted to include a picture to give a visual on what parts of the body were affected. So we have the large intestine and then the smaller intestine. Some recommendations for those that have Crohn's is to avoid carbonated drinks and high fiber foods. And some suggestions are to limit dairy products, eat smaller meals more often, drink more fluids, and to consider supplements. Changing your diet can help reduce your symptoms. Your doctor might recommend that you make changes, such as avoiding, as I mentioned earlier, high fiber foods, keeping a food diary to help identify the foods that might be causing problems for you, and then depending on the severity of your symptoms and the medications that you're taking, your doctor might also recommend a more specific diet where it's more high calories, lactose free, low fat, fiber, and low salt. Your medical care providers might also recommend a low residue or low fiber diet to reduce the risk of intestinal blockage and also to reduce the size and number of your stools. So moving on to celiac disease, it is considered an immune reaction to eating gluten that may cause damage to the intestine over time. And gluten is defined as a protein that is found usually in wheat, barley, and rye. And if you have celiac disease, eating gluten triggers an immune response in your small intestine. Over time, this reaction damages your small intestinal lining and prevents it from absorbing nutrients. And then it can also cause diarrhea. Here we just have these hair-like structures within our intestines that help absorb the nutrients, but as you can see, someone with celiac disease over time, it kind of just goes away and you have more difficulty absorbing the nutrients that you need from your foods. Moving on to symptoms, the main ones again are diarrhea, nausea and vomiting, abdominal pain. In addition to this, you can also experience bloating, fatigue, weight loss, anemia, and other serious complications. Unfortunately, there is no cure for celiac disease, So that means that following a strict gluten-free diet is what's really going to help you manage your symptoms and promote intestinal healing. So moving on, um, some suggestions for those that have celiac disease is to avoid foods such as barley, malt, rye, and really there's just a longer list of things that you should avoid, especially when you're looking at an ingredients list to figure out whether or not it has um, gluten in it. But unfortunately, I didn't want to have a huge list for you here. Um, but it's also important to be cautious that gluten can be hidden in medication, supplements, vitamin supplements, oral hygiene products such as toothpaste, beauty products such as lipstick or chapstick. Um, However, some recommendations are to either take supplements from pills if they don't have gluten in it, or by injection if you're still not getting enough nutrients or absorbing enough nutrients from the pill. Uh, and it's also recommended that you talk with a dietitian on what you can and can't eat. From my understanding, natural foods aren't going to have any gluten, so you're good with vegetables and fruits. And then I kind of just wanted to go over the differences between Crohn's and celiac disease because they do have a lot of similarities in the symptoms. And I know myself, I was kind of confusing the two. So first off, the first difference is the cause. Celiac disease is caused by an inflammatory response to gluten, whereas Crohn's disease does not have a clear cause. In addition to this, in terms of diagnosis, um, celiac disease, you get a procedure called an endoscopic biopsy. Crohn's disease, you'll get a colonoscopy and an upper endoscopy to look at your colon and small intestine. I believe this is where they kind of put a narrow tube with a camera in you. And also, in terms of treatment for celiac disease, the main treatment is eliminated gluten from your diet. And for celiac disease, it might also be to eliminate, let's see, a gluten-free diet may help as well. Sorry, I just wanted to correct myself. Celiac disease is where treatment consists of eliminating gluten, whereas Crohn's uses more medications, and you might have to have surgery to remove damaged areas of the digestive tract. And however, for Crohn's, some patients or individuals do um, benefit from going gluten-free. Um, okay, so moving on to the next disease, irritable bowel syndrome. This is described as a common digestive disorder that affects the large intestine. The cause is unknown for IBS. However, it is suspected that the nervous system, the muscle contractions in the intestine, infection, stress, or changes in the gut microbe can play a role in IBS. Moving on to the symptoms, obviously some of the more common ones are abdominal pain, bloating, relating to passing bowel movement, or changes in appearance or frequency of your bowel movements. Additional symptoms include weight loss, diarrhea at night, rectal bleeding, iron deficiency anemia, unexplained vomiting, difficulty swallowing, and persistent pain that isn't relieved by passing gas or bowel movement. So in terms of the recommendations, those that have IBS are told to avoid high gas foods, especially if you experience more bloating or gas. You might want to avoid things like carbonated drinks or alcoholic beverages, and you also might want to avoid gluten, even if you aren't, or even if you don't have celiac disease. Some have reported improvement in diarrhea symptoms if they stop eating gluten. And another thing that you would want to eliminate from your diet are, they're called FODMAPs, and they stand for fermentable oligosaccharides, disaccharides, monosaccharides, and polysaccharides. And basically, these are found in certain grains, vegetables, fruits, and dairy products. I have a chart, I think, in the next slide that kind of goes over the FODMAPs. And some recommendations are, additional recommendations are to eat high fiber foods, stay hydrated, exercise regularly, and take supplements and take your supplements and medication. And this is also, you can um, be more successful in your bowel movements, but also to manage your symptoms. So as I mentioned earlier, this is kind of a breakdown of FODMAPs and foods to avoid when you have irritable bowel syndrome. Um, so I'm assuming kind of like the sweeter fruits here, lactose, basically a lot of the dairy products, all of them. And then we have the grains here that we would also want to avoid in things like cereals. So moving on to the dimensions of wellness, I think that the main dimensions of wellness that these diseases really were interconnected with were emotional, financial, physical, and environmental wellness. Um, First off, for celiac, I've connected this one more with financial because gluten-free food, at least from what I've noticed and kind of what I saw online, was that gluten-free food can be more significant or can be more expensive than foods with gluten, which makes sense because most of the foods that do have gluten are processed and they tend to be cheaper. And then for environmental, I kind of started thinking, well, do you even have access to gluten-free options in your grocery stores? Or when you eat out, for some, it might not be as readily available in their community or in their surroundings. And then in terms of emotional wellness, this one was more kind of tied to irritable bowel syndrome, where many people with moderate to severe IBS reported poor quality of life. Um, and this kind of stemmed from the fact that those with IBS tend to spend more days from work or personal events as those do without bowel symptoms. What I mean by this is that those with IBS tend to spend um, more time either in the hospital or having to manage their symptoms compared to those that don't have IBS. And for IBS as well, another um, important factor was mood disorders. So, experiencing the signs and symptoms of IBS can lead to depression or anxiety, and it can also make it worse, your condition or your symptoms worse as well. And I also wanted to tie in, obviously, physical wellness because it's a lot to go through. All three of these kind of had shared symptoms such as fatigue, malnutrition, pain, discomfort. And for Crohn's, there's even the possibility of having surgery. And any surgery is still trauma to the body, and you still have to recover. Oops, sorry. So moving on to the meal plans for these three diseases, I kind of had a little bit of fun with it. I was missing food from home, so I kind of put a lot of it into the meal plans. So first, for celiac disease, this is where we want to avoid anything with gluten. So I decided to go for more um, natural ingredients like fruits and vegetables that haven't been processed. So for breakfast, this is a dish. It's really just rice and beans with pico de gallo on top, but it's referred to as gallo pinto in um, in most Latin American or Central American countries, and it's just cooked together. It's really good. Something to note though is that the rice, although you can eat rice, you do have to make sure that it hasn't been um, handled anywhere where a gluten product was processed, if that makes sense. And then also the gallo pinto, you can add eggs on the side, or you can also eat it with um, fried